Now it's a pleasure to hand over to Chris Davis, who is a paediatric endocrinology specialist nurse. And Chris is going to talk about the paediatric endocrine specialist nurse role supporting growth hormone adherence. Chris.
Lovely. Thank you very much. Okay, so as you just said, my name's Chris Davis and I'm the endocrine specialist nurse. That's my disclosure slide. Right, so what do we actually do as a paediatric endocrine specialist nurse? Well, we do a lot, obviously I'm going to say that, but we support health professionals, families and patients with the aim to improve growth response and adherence to growth hormone therapy. But how does this all work and relate to clinical practice, and what measures can we use in order to support the patients and their families when growth hormone has been prescribed? So we've seen lots of very good presentations and the same words are coming out: knowledge, experience, information, adherence and commitment. So when and how, that's me, will the specialist nurse become involved to support all of these important issues? Well, hopefully we're involved prior to the initiation of treatment. Hopefully we're established, or we're going to establish, a relationship with the family and the patient. It makes a huge difference when you've got a family and the patient coming into the consultation room and they have a face that they know, that I've already spoken to them. They come in, they go, "Hi Chris, you know that you're on a good roll to begin with." Be aware of any previous medical history. We'll go into that in the next slide, but be aware that this might not be their first time that they've been in hospital visiting the consultation. Establish whether the family have already accessed information, and if so, is it correct? It's very rare that a family will come into the consultation if they know we're going to be discussing growth hormone and they haven't Googled, they haven't gone on a search engine. What you need to find out is the information they've accessed, is it correct? Establish how keen the family and the patient are to start growth hormone. It's not always happy families and happy patients. We need to see where our starting benchmark is. Ensure sufficient information has been given and offer opportunities to discuss any concerns. Don't give them too much. If you give them too much, the amount of patients who can go home and say, I can remember the first few words, but give them information, the important, that they can then go home, build on it and phone us, I hope. And give growth hormone device choice if possible. That's not, as we've heard now today, it's not always possible. It depends on the area, it depends on hospitals, it depends on country. But if you can, it is always good to give growth hormone choice. I'm asked many times. I have a very large area. I will always offer it, but obviously some patients don't want to travel 3 hours down in the road to choose a growth hormone device. So I'm asked an awful lot, what would you choose, Chris? So it's incredibly important, as we were just saying, that you ask the right questions to get the right answers. So, initiation of treatment. Be mindful of the age of the child. The approach is going to be different. If you have a child, say a young lad who's 12, 13 years old, who's not growing, he's been teased a bit in school, his peers are growing more than him, he's going to want that. Most of the time they want to start growth hormone. In comparison to, say, a little child who's 5 years old, they don't understand why we're giving growth hormone. They don't understand why their mum and dad are going to be giving them an injection every night, because they can't see the long term. Be mindful of the diagnosis. I've touched on this. There's a big difference. If you say, for example, you have a child who's had post-oncology. Could have had years of treatment, years of back and forth to the hospital. They don't want any more injections. They don't want to be there with us. Educate correctly. Signpost. If you're educating and you're signposting, be sure you know where you're signposting. Don't just pick up something and say, this looks good, read it. Read it and know that what you're giving them, the information you're giving them, is going to be correct. Practical issues, we've already discussed that as a parent point of view. Practical issues, it's incredibly difficult sometimes. Where's the growth hormone? Can they get the growth hormone? Is it through the GP? Is it through the healthcare? Practical issues, the child away at weekends, is it a split family? And regular contact from the healthcare professional. We always need to keep it in contact, and actually when they start off on treatment, we do. So we have starting growth hormone treatment, we have the worst case scenarios, and I'm sure other nurse specialists watching this have had this. So incorrect diagnosis and dose, hopefully that doesn't happen often. Inappropriate device chosen, that can happen often. If you don't sit with the patients and find out what would work for them, you might choose, or they might choose, the wrong device. The patient does not want the growth hormone. No, some patients don't. Why would a child of 6 want it? Why do they want an injection? There's their understanding. They might have a phobia, as we just said, because of the past. The patient or the family aren't confident. They're upset when they're given growth hormone. Be sure that you know that they have been taught correctly. Patient, family or health professional not committed. This is, as I said before, it's three parts: patient, family and health professional. You need all three of us to work together. And inadequate advice, information, digital tools. So, starting growth hormone, this is an ideal scenario, and hopefully this happens most of the time. The diagnosis is correct and the dose is good. The correct device has been used or chosen. The patient is keen to start the treatment. The parents, the child and health professional are all committed. They're confident in growth hormone delivery, and adequate information and advice and digital tools have been given. So e-health, supporting patients, families and health professionals. When someone said to me not that long ago, do you use e-health? I thought, I don't know what e-health is. What's e-health? What's e-health? Even though I'm not Florence Nightingale, what's e-health? E-health is something we use every single day in our working life, but we don't think about it. Now, I find that health information is enhanced using electronic technology. As I was just saying, you can give information in consultations, you can back it up, you can enhance it by giving websites, correct support groups, the health literature support groups as well, the apps we were just talking. We've had a very good talk from the parents. I will always advise support groups. They've been there, they've trod that path, they've worn that t-shirt, they know the answers to lots of things that we don't. Any type of monitoring system, and young adults and most citizens have mobile phones and a computer. You can go outside today and you can look, and most people have got their heads down within a mobile phone. But with the good side of it, you have this constant availability of clinical information and of your support networks. So how do we keep the family and patient motivated? So this is the question of all questions. Personally, I think regular contact, keep in contact with them. When we're setting up, we're all in contact. There might be some testing, there's lots of phone calls, we're in contact. When we start them on growth hormone, there's a lot of contact. There could be blood samples, but we do pick up the phone and say, how are things going? But does it continue? We need to reinforce what we've said, the education, the phone calls, the visual aids. Be there. Use the clinic appointments to discuss and show the growth chart. That always goes down a storm with children because, as we were just saying, it's not immediate. The growth, they don't shoot up. I say to my patients, you're not going to start this and you're not going to grow overnight. This is a slow process. But the growth charts, children and families like to look at the growth chart. They like to see that little bit. You can't take the growth chart. You could take the growth chart home with you, but I always think you've always got a door at home. You've always got a door frame. You can mark it. Get children to see how they're growing. Take time. Katie Frost has had a really good talk. Take time to talk to the families and patients. It's not just about ask the right question, you get the right answer. It's ask the right question in the correct format to get the right answer. If you take your time and talk to families in the correct way, you get many answers that you probably weren't expecting. I had a family not long ago who the child wasn't growing. But when you look back, they're picking up the growth hormone, they're getting it from the GP at the correct time. Why aren't they? But when you sit and take time, and I had a chat with them, they're not giving it. They're stockpiling the growth hormone because they don't know how to give it now. They're scared to ask again. They think that we're going to stop giving out growth hormone. On the other side, we had a child who wasn't growing and all of a sudden started growing. I thought, oh, they've used their star charts very well, or they've put their head against the wall and measured their patient. And know what it was? They've actually given themselves a dog. So the use of support groups that we've discussed about, the use of support groups, so good for parents to talk to other parents. And digital devices, discuss the uptake and adherence with a non-judgmental approach. And the apps which we've talked about, the web-based support, I can't be there, we can't be there 24/7, but the internet can. So, overview of maintaining adherence. Adherence decreases in time. Why is that? Well, realistic and unrealistic expectations. It hasn't happened overnight. There's no immediate, the obvious, the response. It's a slow process. They're bored. They're bored with giving it every night and they can't see the difference. The support can ease off. As I said, we're there at the beginning, maybe not afterwards. You need to keep regular contact. And they're tired. You talk to some parents, they're just tired with arguing with their child. It becomes an absolute process every night, watching the time, knowing they've got to give growth hormone, and they are tired of it. Intentional and non-intentional that we've heard from John. Age, motivation, understanding, and what we have, applying support. So we need to apply the support with the practical skills to help us. So long term, so we maintain support and positive relationships with the family and the patient. Everyone needs to continue to work together, ensuring a combined committed goal of optimal response to growth hormone therapy. And finally, by using a personalised approach, technology can be positively integrated into care, supporting all, assisting adherence and optimising outcomes. Thank you.
Thank you very much indeed. So you can see the key role that a specialist nurse in paediatric endocrinology can play in the management of patients. I appreciate that not all centres are able to have specialist nurses, but I would encourage you to consider having some of your nurses become specialised in paediatric endocrinology, and you can see what a key person in the team somebody like Chris is.